So we know that we have fibroids. They're causing either symptoms or infertility, enough for us to want to do something about it, right? So here are some of the management and treatment options. Before I go into them, it's important to note that whether or not you want to become pregnant is going to help us to target which management options are offered to you. So some of those options are going to be the birth control pill or the IUD. These won't actually shrink the fibroids. What they do is they help the amount of bleeding. So if you're losing a lot of blood during your periods, this might be a good option for you. The other option is a medication that may put you into a medical menopause. It literally will shut down your ovaries. So if your ovaries are not ovulating, then you are not getting a period. And if you are not getting a period, you are not bleeding down to a hemoglobin of 4 every month. This option, typically, we can use it to shrink the fibroids before surgery if you are getting surgery. This is typically a temporary option altogether. You can't use it for a very long period of time. The other medical option is a medication known as tranexamic acid. This is a non-hormonal medication that's just going to help to reduce the bleeding overall. It doesn't do anything for the size or the presence of the fibroids in and of itself. And then, of course, you have your surgical options, which are obviously a little bit more invasive. If you are wanting to be pregnant and fibroids are the cause of the infertility, myomectomy can be performed, and this can be done under many different routes. You can use small incisions, large incisions, maybe going inside of the uterus. And then if you don't have any further plans for childbearing, there's the option of a hysterectomy, which is removal of the entire uterus altogether. Again, multiple routes for the surgery. And of course, there is the uterine artery embolization. This is actually done by a radiologist. They go in and they block the arteries that supply many fibroids. The idea being you just basically starve the fibroid and they can shrink altogether. So tell me, did you guys learn something new? Have you had experiences with any of these? Let me know in the comment. Love you, mean it.